What is Cesarian section? Cesarian section, often called CS, is a surgical way of delivering a baby. During this procedure, doctors make a cut in the mother's abdomen and uterus to take the baby out. It is done when a regular vaginal delivery might be risky for the mother or the baby.
In cesarean section, there are two types of skin incision. First is the horizontal or the transverse or bikini line. Second is the vertical or the midline. Most of the women have a transverse skin incision, which is made of 1 to 2 inches above the pubic hairline. The advantages of this type of incision include less postoperative pain, more rapid healing, and a lower chance that the wound will separate during healing. Also, less commonly, the woman will have a vertical or up and down skin incision in the midline of the abdomen. The advantages of this type of incision include a slightly more rapid access to the uterus. For example, if the baby is in distress or if the woman is bleeding excessively.
A cesarean section, often referred to as a C-section, is a surgical procedure in which incisions are made in a woman's abdomen and uterus to deliver a baby. Some cesarean sections are planned. More often, however, the need for the procedure becomes apparent after the onset of labor when abnormal conditions make a vaginal delivery unsafe for the mother or her baby.
I call you when I need you and my heart's on fire. You come to me wild and wild. You come to me and give me everything I need. Give me a lifetime of promises and a world of dreams. Speak the language of love like you know it.
What causes cesarean section? They are performed when a vaginal delivery is not possible or safe, or when the health of you or your baby is at risk. Doctors will perform a cesarean when the low-lying placenta partially or completely covers the cervix. To understand placenta previa, here's a video.
Healthcare providers might recommend C-section if labor isn't progressing normally. Labor that isn't progressing is one of the most common reasons for a C-section. Issues with labor progressions include prolonged first stage or prolonged second stage. So, prolonged labor that has slow progression, whether in the first or second stage. If your body isn't born after 22 or more hours of contractions, you're most likely in a prolonged labor. So second, the baby is in distress. Concern about changes in the baby's heartbeat might make a C-section the safe options. So, fetal distress is a sign that your body is not well. Your doctor or midwife will monitor your baby's heartbeat during the pregnancy and labor to assess their well-being. If your body shows signs of fetal distress, your midwife or doctor will not quickly to try about treat and any underlying causes. Some common signs and symptoms of fetal distress include abnormal heart rates, decrease in fetal movement, material cramping, abnormal material weight gain, vaginal bleeding, and lastly, meconium amniotic fluid.
A multiple pregnancy means you're pregnant with more than one baby. A multiple pregnancy usually happens when more than one egg is fertilized. It also can happen when one egg is fertilized and then splits into two more embryos that grow into two or more babies. When one fertilized egg splits into two, the babies are called identical twins. They look almost exactly alike and share the exact same genes. When two separate eggs are fertilized by two separate sperm, the babies are called fraternal twins. They don't share the same genes and are no more alike than any siblings from different pregnancies with the same parents. And there are questions that how do we know if you're pregnant with multiples or multiple pregnancy? First is your breasts are very sore and you're very hungry or you gain weight quickly in the first trimester. You feel movement in different parts of your belly at the same time. You have the severe morning sickness.
The placenta is the organ that connects the fetus via the umbilical cord to the urine wall of the mother. This is where the exchange between maternal and fetal blood takes place. The placenta provides the fetus with oxygen and nutrients and takes away waste such as carbon dioxide. Normally, it attaches at the top or side of the uterus at birth. It is delivered after the baby. In the third stage of labor, placenta previa, or sometimes referred to as low-lying placenta, is a pregnancy complication in which the placenta attaches to the lower end of the uterus near or covering the cervical opening. Placenta previa can be classified as complete or marginal. The main symptom is painless bleeding in the second half of pregnancy.
So the next one is prolapse umbilical cord. To those who don't know, umbilical cord is a flexible tube structure that transports nutrients and oxygen to the fetus during pregnancy. Going back to prolapse umbilical cord, so it is a serious problem during childbirth. Normally, the baby comes out followed by umbilical cord, but in prolapse, the cord slips out of place before the baby comes out. This can be dangerous because the cord might get squeezed between the baby and the birth canal, causing problems with oxygen and blood supply to the baby. It needs immediate medical attention to ensure the baby gets enough oxygen and is delivered safely. The next factor that leads to cesarean section is health concern. When a woman has a certain health problem, such as brain or heart condition, it might not be safe for her to give birth naturally. In such cases, doctors might recommend C-section or cesarean section, which is a surgical procedure where the baby is delivered through the mother's abdomen. This helps ensure the safety of both the mother and the baby during childbirth.
There is a blockage, a large void blocking the birth canal, a pelvic fracture, or a baby who has a condition that can cause the head to be unusually large, severe hydrocephalus, might be reasons for a cesarean section.
Women who have had a cesarean section or C-section with their first pregnancy are interested in a vaginal delivery for a second or later birth. For years, women who'd had a C-section were encouraged to skip vaginal deliveries altogether and schedule C-sections for all future births.
Physical impact of a C-section. After a cesarean section, you might feel sore or having scars on your belly. It could take time to heal and you may need help with daily tests. So, Infection of the womb leaving is common symptoms include a fever, tummy pain, abnormal vaginal discharge, or heavy vaginal bleeding. Excessive bleeding uncommon. This may require a blood transfusion in severe cases or possibly further surgery to stop the bleeding.
Is normal delivery painful?
Yes.
Were there any complications that happened after your delivery?
Based on my experience, I don't have any complications during that time, during my normal delivery.
What do you prefer, normal delivery or cesarean section?
For me, I prefer normal delivery because aside from it is much cheaper, it is more of comfortable. Comfortable.
Have you felt emotional or stressed after giving birth?
Maybe. It is normal to be emotional.
The impact of cesarean section has many consequences. For psychological impact, having a cesarean section can bring mixed emotions, especially to the mother. Some people feel relief and joy at having a healthy baby, while others might feel disappointed or even a bit sad about not having a natural birth. It is common to feel overwhelmed, tired, or anxious.
Talking to loved ones and seeking support can help cope with these feelings. The birth of the baby can start a variety of powerful emotions, from excitement and joy to fear and anxiety. But it can also result in something you might not expect, this depression.
Most new moms experience postpartum baby blues after childbirth, which commonly include mood swings, crying spells, anxiety, and difficulty sleeping. Baby blues usually begin within the first 2 to 3 days after delivery and may last up to 2 weeks. Psychological impact.
Good morning, ma'am. Naro kay question ni more. Kay karon may sugot mo na ikaw ang isa sa akong interviewee. So akong basahan mo ang first question. How do you feel after plan the cesarean section?
Ano naman itong di-plan? Dili plan nga masiis ko. Masiis ko because emergency.
Naay ka na, ang baby mo unsa dako ang baby ra or
No, because of my BGM. Diabetes.
diabetes? How are you feeling after the cesarean section?
Happy and painful.
Next, how do you recover from cesarean section trauma?
Matinood lang, wala ko naka-recover pa hangtod karon because naaman dito postpartum. 10 years pa ako sa mawa ang postpartum. So, nagid gihapon siya. Pero dili madala ra siya, madala ra ka nang madala smile. As long as di lang jud ka mag-inusara.
How are you planning to have another baby?
Dili plano pero nakaduhaan jud.
So, di ba, wala pa naka-recover na usa na sunod.
Oh. Pero fully healed na ako ang akong tahe, ang ako ang opera, fully healed na siya, kay 10 years man usa na maghural.
Is your baby healthy or having any issues after the birth?
Ang first is healthy, ang second is dili pa jud ta sure kay wa pa man siya nag 1 year old. Is 9 months pa man siya. Pero as long as wa pa man siya nagwano, okay pa man po siya ron. Mo sa ganun healthy pa jud siya kaayo.
Healthy pa. Are you or your baby in immediate distress? Like, mo something na
Wala.
wala ra? That's all. Thank you.
So here is the first question. How do you feel after a planned section?
Actually, I didn't have it planned, like the C-section delivery. originally I planned to have a normal delivery, but then I had a pre-rupture of membrane. That's why, and my cervix didn't fully dilated to 10 cm. It's only about 6 cm. That's why my OB decided to have a cesarean section for me to deliver my baby.
Second question. How are you feeling after C-section?
Honestly, like the suture was very painful, and then you are so like you feel so pressured because the nurses will always go inside the room and then follow up if you have ever like urinated, or then like like have you produced any stool. For you to be able to be discharged just like for the duration of 3 days lang.
How do you recover from a C-section trauma?
Honestly, I didn't have any trauma, like the pain, because most of the C-section moms, they always say that it's really painful when it comes to the epidural anesthesia, but then I didn't feel any because my labor is more painful than it. So maybe when they did the C-section, I didn't feel anything, like no pain at all.
Okay, so are you planning to have another baby?
Yes, of course, because my baby right now is so spoiled, so that's why I think she needs a brother or a sister. And then for the next baby, I'm actually planning to have a vaginal birth after C-section. That's why I decided to have a contraceptive. I'm on implant right now. It's for 3 years, and my OB said na it's ideal because for you to have a normal delivery again after a C-section is like you'll have a gap for 5 years of not getting pregnant at all.
So, fifth question. Is your baby healthy or having an issue after the birth?
No, my baby is healthy and she didn't have any antibiotic injected on her, and then we got out of the hospital for 3 days.
Last question. Are you or your baby in immediate distress?
No. I only had C-section because I already told you earlier that my cervix didn't fully dilated. That's why my OB actually gave me 12 hours. So I labored for 14 hours, and then my cervix didn't fully dilated talaga. It's just for 6 cm. That's why I was on C-section.
Okay, that's all. Thank you.